Hello, once again, first aiders. This is the introduction to learning module 9, bone, joint, muscle injuries, extremity injuries, and splitting extremities. Let's take a quick tour through it so you can see what you're up against. So let me go into your view so you can see what things look like. There we go. I keep forgetting it kicks me back out to that. All right, so again, it starts off with your typical PowerPoint. Lots of information in that PowerPoint. If you can't find it in the book readily, you might check the PowerPoint. Also, again, you have the notes from the publisher. This is out of edition 6. Again, if you can't find it in the book readily, check the notes. These are two things that I should have reminded you of earlier on in the semester, but I didn't. I kind of figured that you would do it naturally, but I just want to remind you that it's there. Next is the type of fractures. It's a quiz. Fracture care, another quiz. Ottawa ankle rules. Let me explain this Ottawa ankle rules for you real quick. All right. So this is the decision tree from Ottawa. The ERs in Ottawa, Canada, seeking a way to minimize the cost of X-rays for ankle sprains. They came up with these injuries, and this is what we use here at CASC with our athletes to determine whether we need to send them to the hospital for an X-ray. I thought this would be a good spot to put this in for you guys. That way, if you ever encounter a sprained ankle, your kid, yourself, your husband, your wife, whatever, that you could employ this to see if they need an X-ray. Obviously, if your gut is telling you you need an X-ray, then go get an X-ray. But so say somebody twisted their ankle and come down here. Are the bones in the right place? So you look at it, you take a general look down at it and just see, does this ankle look like every other ankle I've seen except for probably some swelling? If that answer is no, they look out of place. It flows over here, immobilize in position found, and transport to the ER. If the bones are in the right place, it rolls over here to yes, comes down to here, and then you're going to look and see if there's pain to the touch over the distal 2.5 inches of the medial malleolus. Now, the medial malleolus, follow me down here, is that inside bone part of your ankle. And what you're going to do is you're going to poke on it. And if it hurts over the last 2.5 inches or so over it, then we're going to refer them to X-ray. Immobilize in position found, transport to ER. If they're not terribly tender over that, we go to no over here, flows down, and pain to the touch over the distal 2.5 inches of the lateral malleolus. Follow me down here to the bottom. The lateral malleolus is right here. It's the outside part of what is commonly called your ankle. So you're going to poke along that bone, along the last 2.5 inches of it. If that's not expressly painful or especially painful, then you follow this note. If it is, then yeah, it's time to go get an X-ray. That's no. Then we look for pain to the touch over the base of the 5th metacarpal. Now, the base of the 5th metacarpal, if you take your shoe and sock off and you look down and you look on the outside part of your foot, some of you may see a little bump there, located about in this area right here. That is the base of the 5th metacarpal. There's some muscular attachment to there that can sometimes pull off or break away a piece of that bone. So if that hurts to poke on, I mean, not just barely touching, it's kind of a good solid poke for these things. If there's pain over it, then yes, we're going to send them to the ER for X-ray. If it's no, we come over here. We're going to say pain to touch over the navicular. Now the navicular is located in this portion of the foot. It's a rectangular bone and it's found just where the foot starts in there. So about in that area. And we're going to poke on it. It's what's called a tarsal bone. And those of you who've had anatomy should know what tarsals are. And if it hurts to touch over that, I mean, we're, again, like I said, we're poking on it. We're not just namby-pamby, we're poking on it. Then yes, then transport to the ER. If no, then we come over here and say, can they walk 3 steps unassisted, even with a limp? So if they can walk 3 steps without you helping them, without them leaning on something, without a crutch or a cane or anything like that, and they could, I mean, they could really limp hard, that counts as 3 steps. And if they can't do that, if it's too painful for them to walk at least 3 steps, then no, then we're going to send them to the ER for an x-ray. If they can, then what we're going to do, the treatment for this is PRICE, P-R-I-C-E. P stands for protection, R for rest, I for ice, C for compression, E for elevation. With the compression, what we typically use are the elastic bandages that we've covered in previous learning module, aka ACE wraps. Elevation, we want to elevate above the heart, and we want to protect and rest, you know, and ice and elevate and all that about 2 hours every 20 minutes every 2 hours while the person's awake, and give it a couple of days to kind of calm down. Here we have notify sports med staff within 48 hours, ice 20 minutes every 2 hours. So that is ankle decision tree, more commonly known as the auto ankle rules. And this is what we employ with our own athletes here at Carl Albert State College. Then ankle injury. And this is an assignment using the auto ankle rules, which is the thing we just looked at. List the 6 items to look for to get an x-ray following ankle injury, ankle sprain. Let me back up, show you that again. 1, 2, 3, 4, 5, 6. You're welcome. There's your answer. Then we have the sprains and strains video. If you're not watching these videos, you're missing out on a lot. Basically, a sprain, SP, is something that happens to a ligament. And a ligament is a piece of tissue that attaches bone to bone. A strain, ST, happens to muscle and tendon. Strains we commonly call pulled. A pull. I pulled my hammy. I pulled my groin. I pulled my quad. Those are strains, and these are physical tears. Now, to be a tear, say this is our ligament intact, and I tear it right here. It's torn, right? So it could be a small tear, it could be a medium tear, or it could be a large tear. A tear is a tear, and just because it's torn doesn't necessarily mean it's torn all the way. And there are different grades to it. In fact, there are 3 grades, grade 1, grade 2, grade 3. Guess which one is the worst? You're right, grade 3 is the worst. Grade 2 is in the middle. Grade 1, while they hurt, they're the least injurious. Grade 1s heal pretty fast. Ligaments tend to heal in 6 to 8 weeks. And strains or pulls tend to heal in 4 to 6 weeks, somewhere in there. Then we go to a video for first aid for dislocation and fractures. Watch the video. Then we transition into chapter 15 in the version 6 or the 6th edition, and it's extremity injuries. Again, you get the PowerPoint. You get the class notes, you get an exam over extremity injuries. Then you get splinting. So this is chapter 16 in the 6th edition. So we're hitting 3 chapters in this thing. So again, we have the PowerPoint, the class notes, and then a splinting assignment. This is kind of a fun assignment. I like to grade this one because I like to see the things that you can come up with, creative things that you can come up with to do this splinting. So you're gonna have to get into the book, the PowerPoint, and the notes to figure out how to splint a finger, a forearm, wrist, an entire arm that's straight, an entire arm that's bent. A sling for an arm, which most of you saw a sling because I noticed that a lot of the triangular bandaging pictures and the cravat bandaging pictures that you sent in were actually a sling. Lower leg and ankle, entire leg straight, and entire leg bent. Now, right now, you don't know necessarily how to do that. That's why I need you to get into the chapter. That's why I need you to get into the PowerPoint and the class notes. That will teach you everything you need to know. Don't go out and buy any splints for this. This is something that you should be able to do on the fly. For example, say I needed to split my finger straight. What I could do is I could grab a pencil and tape the pencil on there. Now my finger is splinted straight. I could break it. That way it's splinted straight. Entire arm, leg, or entire arm bent. What the picture shows right here is how to do a forearm. This is showing how to see how his leg's bent. This is showing how to splint the bent leg. Now, if you have a fracture or a suspected fracture, you splint it in the position you find it in, and then you transport them to ER or to the doctor for X-ray. I can't stress that enough. You splint them in the position you find them in. And a lot of times that is in a bent arm or a bent knee. I had to, when my son, who's now 18, but when he was 4 or 5 years old, he was playing football with his older cousins and got rolled up on and broke his arm. And he came in with his arm like this, crying. So what I had to do is I had to splint from here across to here. That way I could splint it in the position found while we took him to the ER to get it x-rayed. So anyway, this is a longer learning module. We're covering 3 chapters, 14, 15, and 16 out of the edition 6. I believe they're the same in the 7th edition. So I'm giving you 11 days to do this. Anyway, that's all I have to say. Keep late work coming in. That way we don't fall too far behind. Do a little bit each day. That way you're not pressed to do everything all in one day. Anyway, I hope you all have a good day, and let me know if you have any questions.